Good evening, good evening, good evening. Gonna give it a few minutes for persons to log on. Welcome, welcome. Just giving it a few minutes for persons to log on. Don't want anyone to miss anything. Okay. Good evening, everyone. My name is Sandra Samuel, CEO of Totally Male, and we want to welcome you once again to Boss Lady Live with Dr. Bill Aiken. This is part 2. We started last week with penis health, and in closing last week, Dr. Aiken said to us that there's a whole other side of penis health. So we want to welcome Dr. William Aiken once again, and we just want to thank him for, joining us, because we know he's very busy and he's a family man. So, we just want to thank him very much for spending this time with us. We want to thank all our viewers for joining us, and just to let you know, we're also live on YouTube. So that's an addition this week. So we're good. Hi, Andrea. Thanks for joining. So we are growing. Hopefully, no technical difficulties this week. We're good so far. And so welcome, Dr. Aiken.
Thank you, Sandra. It's good to be here again.
Yes, you saw the comments last week?
Some of them.
Listen, people were saying how you break it down. Even somebody who not even educated could understand what you were saying. I guess that's a lecturer in you.
I guess
But
so.
it was an awesome presentation last week. And this week, let us just say to us what you're going to be discussing. Just a little overview. No, let me not preempt. So last week, let me just do a little overview. Last week we went deep in depth into penis health and what needs to be done health-wise, diet-wise, exercise-wise, body size, and just the whole care of the penis and all of that. This week, we'll be talking about fractures, you said, Doc?
Yeah, penile fractures.
Mm-hmm.
Penile fractures which is a catastrophic injury of the penis men may get during intercourse and doing other things with the penis as well.
Okay, and I have some questions that persons asked me to ask this week. So let us just start, because the time really runs off very quickly. So you are saying that men get fractures during rough sex and other ways. So let's just break it down as you do in your best style.
Sure. So a fracture is not really a fracture in the true sense of the word, as when a bone fractures.
Right.
But it is a medical term that is used for when you have a tear in the tissue that surrounds the erectile body of the penis, what is called the tunica albuginea, which is just a term used for the covering of the erectile bodies, known as the corpus cavernosa. So when this tears, when a penis gets erect, this covering gets very thinned, and if the penis is subjected to a sudden angulating force, it can tear or snap. And this typically occurs when the penis, in Western countries, when the penis slips out of the vagina during intercourse, especially during rough intercourse. So when the penis slips out the vagina and the penis is struck against the woman's thigh, or what is known as her perineum, which is that area between the vagina and the anus, or maybe struck against her pubic bone, and that sudden blunt force to the penis causes the tunica albuginea, or that covering of the erectile bodies, to tear and snap. And so the blood that is in that area under pressure is suddenly released. So typically what happens is that during intercourse, the penis slips out, it is struck against the woman's thigh or bottom or perineum, and the man experiences a sudden severe pain. He hears a snapping sound, and then the penis swells up so big and becomes deformed because all that blood escapes from within the erectile bodies and causes the penis to become very engorged and bruised, and it develops what is called an eggplant deformity because it looks curved because of all the blood in it. And so, a lot of times when this injury occurs, a man is not with his usual partner. Um, a lot of times men have this, when they're out with their outside partner, they're having more intense intercourse. They have this
They're
attitude that they
proving a
want.
point, Doc. They're proving a point. You're
Right,
putting it
right,
lightly. You're going around, but they're proving a point.
right. They want to kill it,
They
and
want to kill it.
right.
Absolutely.
And what happens is that they end up hurting themselves. And the unfortunate thing about it, as I said, is a lot of times these men are not with their regular partners, and so they find a lot of very interesting reasons. They were involved in a brawl in the bar, and somebody kicked them in the groin or something to that effect. The thing is, this injury can only occur with an erect penis. It cannot occur with a flaccid penis. Your penis must
Okay.
be your penis must be erect to get this injury. And because of the embarrassment attending this injury and sometimes the circumstances surrounding it, a lot of times the men don't come to the hospital right away. Sometimes we see this injury several days after it has occurred. The good thing is that this injury is easily diagnosed and it can be repaired fairly easily. And the good thing is that once it is repaired, most patients, the vast majority of men, have a good outcome. They have preservation of their erectile function. In other words, they can still get an erection after it has healed. There is usually no deformity of the penis, and they usually have a good outcome.
So, Doc,
Um,
let me just ask, because I'm sure many of us would like to know. So, what is the downtime? A week to recover? 2 weeks?
Yeah. So typically, we do not recommend resuming intercourse until about 6 weeks after. Yeah, 6 weeks after
Wow.
the repair. Yes. So the man will be down for a while, and so
Is there so is there an inability to get an erection, or the erection will be very painful?
it's not that he would be unable to get an erection, but the erection. Remember, stitches are
Oh, so it would have
holding
to be stitched.
right. It would have to be stitched, and
Okay.
and so you don't want the man subjecting the penis to sexual activity because it may damage the repair, and he may end up in a worse situation than before. So you need time for healing to take place.
Wow.
Yeah.
That is excellent information. Um, the question, is it possible that the penis can repair itself in some cases, depending on the severity?
Yes, in fact, if you do nothing over a period of time, the blood will be resorbed and so on. But that area where it was torn, the blood surrounding it may heal with a nodule, scar tissue, and the penis may become angulated, which is another thing we're going to talk about in this session of condition called Peyronie's disease. So you may have an acquired angulation of the penis. In other words, the penis may be bent, and it may be bent to such a degree that it makes intercourse very difficult. Or the man may have, as I said, a large nodule at that point. So it is best for it to be repaired. What we have discovered recently is that you don't necessarily have to repair it right away. You can allow the blood to regress a little, usually 7 to 10 days after the injury. And we find that if we do it then, instead of doing what is called a degloving incision of the penis, where we have to pull back all the skin of the penis, we can just go over the site where the injury occurred and repair it there. So it's less traumatic and less invasive.
Okay. That has a lot to digest, Doc. Okay, last week we spoke on circumcision, and one of my clients asked me to ask you. He says his son, when he was a little boy, he would play with the foreskin, and apparently, what has happened, he said, is that it has stretched, so it looks like a little elephant nozzle. What he's asking is that should he now circumcise his son?
Well, one of the reasons for doing a circumcision is cosmetic reasons. It is still a valid reason for requesting a circumcision. So if his son is old enough and he's concerned really about the cosmetic appearance of his penis, then that is something that we can do a circumcision for.
He also asked, he said that area when you do the circumcision, where it joins, like when you tie the like where it's stitched.
Right. Where the
If
skin is
that
approximated.
right, if that becomes damaged, is or torn, does it require you going in to a doctor, or it will heal fine on its own?
Well, it's not common for that to happen. If that happens, then you should really go back to the doctor to let the doctor have a look at it
Yes.
and assess whether,
Because it shouldn't tear easily.
correct. I mean, but I'm not sure what timing after the circumcision we're talking about here. If
He
it's
didn't
something,
say. He's planning to sign in today, so hopefully he'll ask the question.
if the wound is fresh and the disruption of the suture line or the line where we make the stitches, where we approximate the skin edges, has been disrupted, then definitely you should go back and let the doctor have a look at it.
Okay.
Yeah.
Okay. So the next issue you were saying?
Well, I don't recall that we spoke about premature ejaculation last week. Up to a third
Oh
of
no, we
men,
did not.
up to a third of men, based on some surveys, suffer from premature ejaculation. So it's a very common problem after erectile dysfunction. It is perhaps the next most common sexual dysfunction affecting men. So that's something that the men may want us to speak about and may be interested in, since so many men are affected by this problem.
Go right ahead, Doc.
All right, so premature ejaculation, there is no universally accepted definition for it. However, men who self-identify as suffering from premature ejaculation, when they studied them, they found that more than 70% of these men ejaculated within 1 minute of penetration, and up to 12% of them ejaculated before penetration. So using a working definition, we could say that men who ejaculate within 1 minute are men who suffer from premature ejaculation. Now, that may sound extreme. Most men take up the average time that a man takes during intercourse before he ejaculates is about 10 minutes. That surveys have demonstrated that. So,
So,
some
so,
men,
so, Doc, pause. Did you say 10 minutes, Doc?
10 minutes,
So
yes.
when we hear these men bragging about, long distance tulla and how they last for hours and all these various accolades that they lay on themselves, are you saying that is not the truth?
Well, Sandra, there are some men who suffer from what is known as delayed ejaculation. And by definition, again, there is no universally accepted definition. But if you are taking more than 20 minutes during sustained intercourse to ejaculate, then you are suffering from delayed ejaculation, more than 20 minutes. And it's
Wow.
and it, men who suffer from delayed ejaculation are equally, if not more frustrated than men who suffer from premature ejaculation, because they do not derive any pleasure for themselves from intercourse. It's frustrating for them, and in fact it's frustrating for their partners as well, because the friction from prolonged intercourse causes irritation of the vagina, and the female partners are frustrated that they're not sexually satisfying their partner. Some of them think that they may have an outside partner why they're taking so long to ejaculate. So it is a condition. Some men may think that they would like to have it, but it's a very distressing condition to have.
But,
So
but, but what about those men that use condoms with those numbing agents, or they use stimulants like what they call it, shiny brush, and those things that, according to what I've heard, that extends the erection for an extended period of time.
right.
So,
So those agents are numbing agents, as you said. They have local anesthetics in them, and basically what they do is decrease the sensitivity of the penis, and by so doing, it enables them to last longer before ejaculating. So if a man is suffering from premature ejaculation, then using those agents may actually allow him to last, um, you know, within the normal, quote unquote, average time that a man could last. But and then those men who who are within the normal range, they sometimes use these agents to enable them to go even longer. But as I said, um, the irritation from the constant friction is something that women may not necessarily appreciate, because after a while,
but but
you
but
know,
Doc, all these DJ songs, these dancehall songs that talk about how they last long and all of this. So therefore, men are exaggerating. Is that what you're saying?
well,
For the most part.
there is a hype and there is a reality. The, sci-
Ah, did you hear that?
the,
There's the
sci-
hype, and then there's the reality.
the science says that the average man
Yes.
takes approximately 10 minutes during intercourse to ejaculate.
So
Um,
therefore, in order to extend a sexual experience, you'd have to do other things.
Correct. So most women need at least 15 minutes of stimulation to achieve an orgasm. And therefore the smart man will ensure that prior to intercourse he stimulates his partner so that she can achieve orgasm before or soon after penetration. That's what the most men will do. As I said, applying these agents to the penis. If you have normal ejaculator response, essentially is not the main way to go. Now, if you suffer from premature ejaculation,
And you didn't
then
say what causes that, doc. What causes premature ejaculation?
okay, there are two types of premature ejaculation, broadly speaking. There is what is called lifelong or primary premature ejaculation, where a man will notice from his very first sexual encounter, he ejaculates quickly. That is by far the more common of the two types, and that is due to an imbalance of certain chemicals or neurotransmitters in the brain, in the ejaculatory centers in the brain. We can talk some more about other theories, but that's a prevailing theory. There is also what is known as secondary or acquired premature ejaculation, and that is where a man who took a normal time to ejaculate suddenly notices that he is ejaculating much more quickly. And that is usually due to things like prostatitis and inflammation of the prostate, or urethritis, where the urethra may be inflamed, or due to psychological issues as well. But as I said, primary or lifelong premature ejaculation is by far the more common type and is successfully treated mostly by medication. Okay, now there are other theories regarding it. One of the common theories is that it's a learned behavior, in that men during their young adulthood days learned to ejaculate quickly because of masturbatory activity where they didn't want to be caught, and so they needed to ejaculate quickly and so on, and they learned this behavior. But as I said, the prevailing theory now, and it is backed up by the fact that the premature ejaculation responds to certain medications that um, adjust the imbalance of the neurotransmitters in the brain, is that it's a congenital problem. In other words, a problem you're born with due to these
Okay.
imbalances. And so the most successful drug that has been used to treat premature ejaculation is a drug that is actually used to treat depression, called serotonin reuptake inhibitors, selective serotonin reuptake inhibitors. Um, and these are what are primarily used to treat premature ejaculation successfully now, because these adjust the imbalance of the serotonin and other neurotransmitters in the brain. But there are other things a man can do. There are certain self-help things that men have noticed over the years. For example, if a man drinks 2 glasses of wine prior to engaging in sexual activity, his ejaculatory reflex will be subdued. And so he will notice that he's able to last longer. If he drinks too much wine, he will get erectile dysfunction. So you
Oh,
have to
it's a delicate balance.
a delicate balance. The other thing that men can do is they can masturbate before they know they're going to have a
Right.
sex.
There's a question here, doc, that says, what about the second time around? So you had a first round of sex and you came, and so what about the second time around? How long should what
Well,
is that average?
well, that was what I was alluding to. So one of the self-help methods is for the man to masturbate before he has a sexual encounter. Now, if he masturbates too soon before that sexual encounter happens, the refractory period that we spoke about last week
Right.
is going to affect his ability to get an erection.
The ref,
So,
and in saying the refractory ability, what he means is after you have an orgasm to be able to get an erection again.
Correct. Right. So the refractory period becomes longer as you get older, naturally. So if the man masturbates too soon before the anticipated sexual encounter, he may find he's not able to get an erection. Whereas if it's too long, the masturbating may be of no benefit to him at all. So again, it's a very
Okay.
delicate
Delicate
balance there.
balance.
The other
There's
thing,
another question that says, Mr. Henry is asking if the person uses something to, a stimulant to um, numb the area, can that cause any damage?
so so the chemical that is used is the opposite of a stimulant. So it's actually a local anesthetic or numbing agent. So it's an agent that numbs the nerves in the penis. So it's not stimulating the penis.
Right.
It's actually numbing the penis. And essentially, what these things are local anesthetic agents. You really can't harm yourself by using these agents, but what you can do is if the local anesthetic comes into contact with the vagina, it will numb the vagina. Um, and so
Oh,
and so you have to be careful in the application of these numbing agents. It has to be done well in advance of the sexual encounter, and you have to make sure that it's thoroughly wiped off the penis before a sexual encounter, or the vagina may become numb.
wow. So, Doc, you also spoke about the penis being curved as a condition. Is that you're born, you can be born, or is as a result of something?
So it can be both. You can have what is known as congenital curvature of the penis. And a lot of men have a slight curvature of the penis, and that's not what we're referring to when we refer to congenital curvature. We're referring to an abnormal curvature, usually downwards, that is significant. Um, but the curvature of the penis that is most common is an acquired curvature, and is it goes by the name Peyronie's disease, named after the person who described it and popularized the disease. He was actually the physician to King Louis the XV, I believe, Francois de la Perrone, and he was the one who somebody had actually described the disease before him, but he was the one who made it well known. And basically, it's an acquired deformity of the penis, usually an abnormal curvature, um, and it may it's caused by scarring or fibrosis um, in the that same tissue that we mentioned earlier, called the tunica albuginea, that surrounds the erectile bodies. That tissue may become scarred, and if it becomes scarred enough, it may cause a tethering of the penis to one side. So the penis may deviate significantly to one side, or it may deviate upwards, or it may deviate in more than one plane. And if the deviation is so marked that it is preventing intercourse or making it very difficult, or if if it is causing erectile dysfunctions, because the scarring can actually prevent blood from going beyond the area of the scar if it is bad enough. Um, so if it is doing any of those, or if it is causing painfully intercourse for the man or his partner, then those would be reasons to have it dealt with. A man may have mild degrees of Peyronie's disease, and it's not affecting his sexual performance. It's not causing pain. It's not causing any problems, and in that case, we wouldn't interfere with it. And in fact, about 12 to 15% of cases may actually resolve spontaneously. But as I said, if it is severe, then we would want to treat it. In the early phases of the disease, pain is one of the most common presenting factors. So the patient may have a pain in the penis or pain on erections. And we usually treat that with anti-inflammatories, things like cataflam and so on.
Okay.
But when the disease becomes burnt out and fixed, and you have a fixed angulation of the penis, if it is, as I said, if it's preventing intercourse from taking place, or if it is causing pain or erectile dysfunction, then we would definitely want to treat the angulation of the penis, straighten the penis for
Okay.
them. And that can be done using a number of surgical techniques.
Um, um, can an oversized prostate cause sexual dysfunction?
Yes, there is an association between an enlarged prostate causing what we call lower urinary tract symptoms and erectile dysfunction. So men who have an enlarged prostate and as a result of the enlarged prostate also have lower urinary tract symptoms, the same ones we discussed last week, the frequent getting up at night, not being able to hold the urine, straining to pass urine, etc., then those men are at higher risk of having erectile dysfunction than men who do not have an enlarged prostate. So there is an association between the two.
Does the angled penis cause damage to the woman?
No, it usually doesn't cause damage. It may, in some cases, it may actually stimulate some areas of the vagina that the
Depends
woman.
on where your spot is.
Correct. But as I said, if the angulation is enough, it may cause difficulty having intercourse. The woman may have to assume some very awkward positions for the penis to be able to enter the vagina, and it may make intercourse awkward and difficult and sometimes painful, but it doesn't usually do any damage.
Okay. I also got a question about genital warts. What
Right.
about genital warts?
So that is something that I see occasionally. As a urologist, I don't see a lot of those. Those may go more to the dermatologist and so on, but I do occasionally treat genital warts. These are caused by human papilloma virus, the same virus that causes cervical cancer in women and penile cancer in men. Um, Human papilloma virus, the serotypes that cause it, 16 and 18, are very common in the population. Now, most men who have HPV do not have any manifestation of it. So a man can have HPV and he does not have any genital warts or any other visible lesion of the penis or visible abnormality of the penis. But some men with human papilloma virus do develop penile warts, either involving the skin of the penis or the foreskin, or the head of the penis, or sometimes even going in the urethra.
Doc, just a second. Just keep on going. I'll be back in 1 sec.
Sure. So these penile warts, cosmetically, of course, they're undesirable. No man wants to have these warts on his penis because, first of all, they're sexually transmitted. The human papilloma virus, which causes penile warts, are sexually transmitted, and they are cosmetically undesirable. Also, the same virus causes cervical cancer in women. So one of the things that, as a urologist, I do for these warts is to burn them off. There are other methods of treating them. They can be frozen. You can freeze them. You can burn them with electricity, which is what I do with what is called electrocautery. You can also use laser to treat them, or you can apply different types of topically applied medications to them. One common one is known as podophyllin, which can be applied locally to the warts, or there's another one known as Aldara, which is available locally, which can be applied to the warts. But these require repeated administrations, and the warts take a while to go away. So my primary method of treating them is to burn them, because when you burn the warts using a diathermic current, or what we call electrocautery, the wart is immediately killed, and it will go away very quickly. Of course, you cannot do anything about the underlying human papilloma virus that is within the DNA of the tissues forming the skin, and that's important to understand. So warts can always come back, and not because
Are warts transmittable?
Absolutely. As I said, well, when you said, I said it was a sexually transmitted disease.
Okay, okay.
The human papilloma virus that causes a wart certainly is transmissible. So it's a sexually transmissible infection, genital warts. Yes.
And the warts come up. Is there, okay, from the point of infection to when you visibly see a wart, can there be transmission during that period?
Absolutely.
And how long does it take to show
Well,
itself?
that's variable, Sandra. So the vast majority of persons who have human papilloma virus do not have any warts, and so
Okay.
and so the absence. Most men who have human papilloma virus do not have any external manifestation of the human papilloma virus. Some men develop warts. Some men may develop penile cancer. Some men their partners may be discovered to have cervical cancer, or changes, what we call dysplasia in the cervix, and they may be referred to a urologist. But really, as I said earlier, there's nothing you can do about the presence of the human papilloma virus. That viral DNA has integrated itself into the human DNA, and it is there. What you can do is something about the external manifestation of it. So you can get rid of the warts either using topical chemicals, or by burning, or by freezing, or by using laser.
Okay. There's another question. Is masturbation a bad thing? And I have a question for you. Can a man get accustomed to his own hand?
Okay, so is masturbation a bad thing? Well, in the early 20th century and before, there were many authors who wrote books that ascribed various sort of mental disorders to masturbation. That has been debunked. So there is no truth to the fact that masturbation causes any of these mental disorders. Masturbation is thought to be a healthy human sexual activity in both men and women. However,
Can you say that again, Doc?
masturbation is thought to be a healthy human sexual activity in both men and women.
Okay, okay. So it's not
However,
only men.
It's not
That
only
is
men.
for. Okay.
However, if someone is masturbating so often that it is affecting their quality of life, their work, and their normal activities of daily living, then that is a problem. And so there are some men who may have an issue masturbating too much that they may need to seek medical attention for. but it is considered a normal human sexual activity. I think you had another question.
Yes, the question was, can a man get accustomed to his own hands? So therefore, his wife or his girlfriend is right there beside him, and he'd rather masturbate than have sex with the partner.
Well, one of the theories for some men developing delayed ejaculation is that when they were growing up, they used very unusual masturbatory techniques that cause intense stimulation of the
And
penis,
unusual would mean something like what?
like pretty rapid vibratory activity,
Okay.
um, and they became accustomed to that as the as this method of stimulation for them to ejaculate. When these men then engage in normal sexual intercourse, the stimulation that they get from intravaginal sex is this stimulation is not sufficient to trigger an ejaculatory reflex, and so they may engage in intercourse and go on and on and on, well past the 20 minutes that I mentioned earlier, which is a threshold for defining delayed ejaculation with normal, usual sexual stimulation. And so these men may suffer from delayed ejaculation or an ejaculation where they can't ejaculate at all during normal sexual activity, because during growing up, during their formative years, they develop these masturbatory techniques that cause really excessive stimulation of the penis. So yes, a man can indeed become accustomed to his own hands, so that normal interpersonal sexual intercourse does not cause ejaculation to occur.
All
And
right. So what about?
as I said,
Sorry, I didn't.
that's one of the causes of delayed ejaculation. Yeah.
Okay. So what about shaming? The mother walks in on the boy in the bathroom, handling his business because he's a teenager and he's exploring, and she makes a big deal out of it, and she has shamed him. Does this have a psychological effect on the child?
Absolutely, it can definitely have a negative psychological effect. So we're now talking about the psychosocial and cultural associations of sexual development and so on. So yes, parenting, bad parenting by shaming a child for what is considered normal sexual activity and sexual
But the church also speaks against it, doesn't? How
church
does
speaks
that work?
church speaks against what?
Masturbation.
Sandra, I'm not aware, but certainly the church that I attend does. I've never heard them speak about masturbation. And as far as I know, the Bible is silent on it. I really don't know of any scriptural context that condemns masturbation. Now, I mean, we're going into the non-medical aspects, but as far as I'm aware, as I said, it's a normal human sexual activity during adolescence and so on. It is natural and normal for people to explore their bodies. And it's usually during those years that men, boys and girls discover their sexuality and so on. And so it is considered healthy. As I said, you can overdo anything, and if it affects your activities of daily living to a point where that's all you're doing, and becoming unconcerned with other important aspects of life, then it becomes pathological at that point. But I'm not aware of any, well, certainly, as I said, in contemporary Christian doctrine, I'm not aware of any dogma that says anything negative about masturbation.
All right. So
Maybe
um,
Rondo.
still on the subject of masturbation, if a mother catches her son masturbating or realizes that he's spending a little longer time in the bathroom than normal, is this a conversation that she has with him, or is that a conversation that she needs to ask another male to have with him?
Well, every situation is different. It depends on the relationship between the boy and his mother. It would not be that would not be the opportune time to have a conversation with him when she catches him. That's a conversation that would best be held at another occasion, um, and could be introduced, by the way, depending on the relationship between the mother and her son. She would have to assess whether she would be the best one to have a conversation with the boy or not, and she would have to examine her own attitudes
Right.
towards sexual practices and sexual behavior, because you don't want to negatively, as we said earlier,
Right.
um, you can scar someone sexually for life, in terms of giving them negative attitudes towards normal, healthy sexual practices. And for example, if a mother thinks sex is dirty and so on, and only to be engaged in for procreation and so on, then she may transmit those attitudes to her son. Um,
Absolutely.
and clearly that would be an unhealthy situation. So it is something that is well known to determine people's attitudes to sex as adults, and it is well known that your exposures during adolescence and young adulthood determine how you relate with the opposite sex and so on. So it's very important that parents recognize this and have a healthy discussion with their
Right.
children regarding sexuality. Yeah.
Question. Girls get HPV vaccine. Should young men get the vaccine as well?
Okay, so you're asking me something that I don't consider myself an expert in.
Okay.
Um, there's a lot of controversy about the HPV vaccine, even for girls. Um, there are a lot of people who feel that they would not want their girls to have it, and the way it was introduced, without widespread stakeholder consultation, a lot of people were offended by that because it was introduced in a manner in which a lot of parents felt that they didn't have an opportunity to have a discussion about it before it was offered to them. So I think that is something that um, each individual would have to decide based on their own um, sexual activity, sexual practices, and potential level of risk.
Right.
Clearly, if somebody is celibate, um, then their need for the HPV vaccine would clearly not be the same as somebody who has multiple sexual partners. So,
Partners, right.
all of those things I think need to be taken into consideration.
Okay. Great. Okay. There's another, apart from erectile dysfunction and premature ejaculation, you also have a situation where the man has an erection, he's about to place the condom on his penis, it goes flaccid. What causes that?
Right. So unfortunately, there are a small subset of men who have that issue. They have the problem that when they are putting on a condom, literally, the erection goes soft. These men find it very difficult to use a condom for that reason. And if they're
Is that
in
something physical or is that something mental?
No, it's absolutely something mental. So it's definitely mental. There is nothing inherent physically about putting on a condom that would cause an erection to go. Some of it may be related to anxiety, some of it may be related to upbringing, but it is a well recognized phenomenon, and it is difficult to advise a person, especially if they are not in a monogamous relationship, because if you're not in a monogamous relationship, then using a condom is is essential to prevent unwanted sexually transmitted infections and, of course, the potential for pregnancy.
Right.
So, it is not an easy situation to deal with. There is the female condom. There is the option of the female condom. So there is that option for the man. But a lot of these men also complain that they don't like the sensation um, of having any sort of membrane between the vagina and their penis. And so,
On the flesh.
yes, absolutely. So it's not an easy problem to treat, Sandra. It usually requires counseling and so on. And again, that's not something I would do. That's something I would refer a patient to a psychosexual counselor for, because
Can
those are
can
primarily psychological issues.
can the woman help?
Yes, a woman can help by using oral and other techniques in placing the condom on the penis.
Okay.
The stimulation orally over the condom, of course, as it is applied, may help to maintain the erection. So yes, the female can help in some instances, but I
Okay.
think those but I think those men really, most of them, and thankfully, it's not a lot of men. you know, uh, it's not a lot of men. They usually need psychosexual counseling. Yeah.
Okay. We're at 52 minutes, Doc. Is there anything that you really want to, in terms of information, that you really want to get out there before we close off?
Well, there's one other common sexual problem that we see in Jamaica that we haven't spoken about. We have a large population of persons with sickle cell disease and sickle cell trait. And one of the common manifestations of sickle cell disease is a condition known as priapism. Priapism is where you have a prolonged, usually painful erection that is not associated with sexual stimulation or sexual desire. It may have been initiated by sexual stimulation, but it goes on long before the sexual stimulation has passed, and it becomes persistent. And it is a deadly condition, deadly to the penis, because if priapism persists beyond 12 hours, you can get irreversible damage to the
Wow.
penis. The penis, because during what is called low flow priapism, which is a type of priapism that persons with sickle cell disease get, the blood flow in the penis is significantly compromised, and so the tissues of the penis become what is known as ischemic. It's not getting enough oxygen, and if it's not getting enough oxygen, the tissues will die. And if the tissues die, it's going to be replaced with scar tissue, non-functional tissue. And if that happens, the man may not ever get an erection again. Um,
Wow.
right. So, and this is a fairly common.
And this is not for the tree. This is like full blown sickle cell.
Right, full-blown sickle cell. There are other things that cause it, though. Up to 40% of cases, the cause is unknown. So we see men who come in with priapism, and we cannot identify a cause, and that is not uncommon. Up to 40% of cases. There are quite a few drugs that can cause it as well, especially drugs to treat psychiatric disorders and other disorders. It can be seen in leukemias and lymphomas, so blood cancers, and lymphoid cancers. And it can be seen in other rare conditions that affect the blood as well. And finally, it can be seen in cancers of the prostate and bladder that essentially grow into the penis. So there are a host of different things that can cause it. But in our population, sickle cell disease is the most common association with priapism. And the reason I want to emphasize it is that it's a condition that needs to be treated urgently. Any man who has an erection that is going on for more than 4 hours continuously um, should should seek medical attention. There are some things a man can try first. He can try jogging on the spot, running up and down stairs, and so on, to try and divert the blood from the penis. But certainly by 6 hours, if you have a persistent erection, especially if it's painful, then you need to go to the accident and emergency department of a hospital and get it treated, because you may have permanent erectile dysfunction as a consequence of having priapism.
Wow. I didn't know that at all, Doc. That is awesome information. I'm sure a lot of our viewers did not know that. There's a question. Is it advised to circumcise your is it is it advised to circumcise your child at birth? And if you didn't, should you bother to put your baby through the stress months afterwards?
No, so routine circumcision is absolutely no longer recommended. Um, Many, decades ago, circumcision was much more common, routine circumcision, but it's actually, considered harmful in some cases. And really, routine circumcision, neonatal circumcision, is only done now for religious reasons, primarily. Um, in an older child where the foreskin may be tight, or for cosmetic reasons, as what spoke about earlier, where the foreskin is very long and it's drooping, then you may want a circumcision for those reasons. But routine circumcision is no longer recommended at all.
Okay. Last week, we got a question after we had signed off. Are there any particular foods that you know of? Because in Jamaica, it's very popular to be drinking strong black Irish moss and linseed, yeah, front end lifter, all of these things that they claim to increase your strength. Are these myths or are these truths?
So, belief kill and belief cure syndrome. There is what is known as the placebo effect. Up to 30 to 40% of men, if you give them a sugar tablet and tell them this tablet is going to do this to you, 30 to 40% of men will actually experience what you tell them the sugar pill is going to do. So
Okay.
there is a placebo effect, which is a psychological effect. And so a lot of these remedies have never been subjected to scientific scrutiny. And the placebo effect is a very powerful effect. As I said, in 30 to 40% of men, a sugar pill will bring about those same changes. So there is no scientific evidence that any of these things work. But if you believe it and you drink it, then in up to 30 to 40% of men, you will experience a beneficial effect.
So there's no recommendation of any particular food, fruit, drink, anything like that, Doc?
And this is for erections.
Erections.
Right. So,
or as we're speaking, penis health.
Right. So erections is, so I'm going to use a technical term here now. An erection is a hydraulic event. It's a neurovascular event. Any food that you eat that improves the health of the cardiovascular system and the nervous system
Absolutely.
is good for your penis health. So what does that mean? It means eating, as I was mentioned last week, many different colored fruits and vegetables. It means getting enough exercise, aerobic exercise. It means getting enough sleep. It means avoiding cigarette smoking. It means avoiding becoming overweight and obese.
And we had said that's 40 inches. Once the waist past 40 inches, you said that the testosterone converts to estrogen.
Absolutely. So
Exam get right.
even before you get to the 40 inches, though, it's just that at 40 inches or
It's
approximately,
problematic.
yes, you run a high risk of getting what is known as metabolic syndrome and all the various things that we spoke about last week, including the testosterone being converted to estrogen and the master gland in the brain, the hypothalamus and pituitary being inhibited because of the hormones expressed by that fat on the tummy. But I don't want men to think that if you have less than 40 inches, you're okay. The aim is to maintain an ideal body weight and to not allow your waist to gain a lot of fat around it, because the more fat you gain is higher the propensity for you to develop these issues, including becoming diabetic and otherwise. So it's important to maintain an ideal body weight. So in terms of food, Sandra, back to your question,
Mhm.
any food that improves the health of
Health.
your cardiovascular system would help.
Okay, and as we wrap up, there are fathers out there watching. Um, is there any information or or there's only certain information that can pass down from a man to a man? Is there anything a man should look to be telling his son about his penis? How to is that something that he should be talking to him about? How to wash it? How to pull back the foreskin? Is that something that should be practiced in the household? Because a lot of them, the women manage the children. Is is it a father son thing? Is it? I mean, we're talking about those now who have that opportunity.
Well, as you said, Sandra, the reality is that in many households there's no father.
Right.
So, but boys need to learn, whether from their mothers or fathers or from school, that if they are not circumcised, one of the things that they need to do on a daily basis, and the vast majority of men are not circumcised because we're not doing routine circumcisions anymore, is,
Okay.
is to retract the foreskin daily and thoroughly wash that area and dry it, and that should be done daily to prevent any buildup of what is called smegma under the foreskin. And if that is done, once you're practicing good penile hygiene, which is doing exactly as I said, then you're practicing good penile health. In terms of food, Sandra, let me just say one last thing. Nitric oxide. We spoke about nitric oxide last week. It's a very important neurotransmitter slash hormone in the body. Nitric oxide is what is released by the inside of the blood vessels and the nerve endings to bring about an erection. There are some foods that are are thought to be good nitric oxide donors, things like beetroot.
Okay.
So in terms of foods, beetroot certainly would be a good um, fruit to eat or vegetable. Nuts are rich in amino acid called L-arginine. which also is a nitric oxide. Nitric oxide is derived from L-arginine. So a diet rich in nuts. Nuts also are rich in what is called um, what we call fatty acids. That you have fatty acids that are derived from animals, which are not good, and you have fatty acids that are derived from plants. Um, so what we call poly and monounsaturated fatty acids are good for you, and you get these things from things like avocado, what Jamaicans call pear, and you get it from nuts. So these things are good for your cardiovascular health and good for your prostate as well. So you asked me about foods. As I said, many different colored fruits and vegetables, including things like beetroot and nuts and so on.
Is there any truth about acne and prostate cancer, doc?
No, there's no truth about that.
Okay.
That's a short answer.
Okay. Well, doc, I can't believe an hour has flown by already. And we just really want to thank you for your invaluable information. Can you just tell us again where we can find you and a number that we can reach you at? Dr. William Aiken, he's a consultant urologist, and he's also a lecturer at University of the West Indies. Go ahead, Doc.
Okay, so in terms of
And
my
what would one come to you for?
okay, so a urologist is really a surgeon who looks after diseases of the male genitourinary system. So that includes things like cancers of the kidney, cancers of the bladder, cancers of the prostate and penis. It includes things like male infertility, erectile dysfunction, premature ejaculation. It includes recurrent urinary tract infections. In women and men, we look after things like kidney stones. We look after urinary tract infections, incontinence of urine, or inability to control the urine. So the three most common conditions that affect the prostate in men: prostate cancer, benign or non-cancerous enlargement of the prostate, and prostatitis. So these are conditions that a urologist treats. Where can you find me? I'm at a
Yes.
place called Island Medical Specialist, which is at 2A Beverly Vale Close, which is at the top of Mountain View. And
And
and the,
number?
the number is 927-3049.
Dr. Aking, thank you. I wanted to say thank you to my Facebook fans. I want to also say thank you to my YouTube fans. So let us meet right here next week for another topic, same time, 8 o'clock. 8 o'clock is working for us. So 8 o'clock next week, Monday, we'll be speaking on relationships, how to navigate one, psychologically, dating tips, how to, manage, the male female interaction, and that is with Miss McKinney, and we're looking forward to that next week, 8 o'clock. So thank you again for signing in and being with us. See you next week. Bye bye. I am Sandra Samuels, Totally Male CEO. Goodbye.
Good night. Good night.
Good night. Good night, Bill. Thanks again.
Sure.